straightening of the lumbar spine and L4, L5 disc bulge, or straightening of the lumbar spine and L5S1 disc bulge. If your MRI or X-ray report told you that you have a straightening of the lumbar spine, which is a loss of a lumbar lordosis, and there's a diagnosis of a disc bulge in your lumbar spine, like L4, L5 disc bulge or L5S1 disc bulge, this video is specifically for you. Straightening of the lumbar spine is a very serious spinal distortion or spinal misalignment, can cause all sorts of low back pain, can cause disc damage and disc bulge, which I'll explain in a moment how that happens, nerve pain, like leg pain, and lead to degenerative spinal changes because of this loss of lumbar lordosis. So in this video, I'm not only going to show you the association between a straightening of the lumbar spine, but also a couple of exercises you can do at home to help relieve the stress from a straightening of the lumbar spine and help to promote a natural improved lordosis. So be sure you watch right to the end to get those exercises. Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen and stabilize and even correct your spine. Like this, you can bend, move, and lift normally without pain and limitation. What that will do for you is have you live a better quality of life free of pain. So if you want these tips and strategies, be sure to subscribe right now by tapping on that red button below that says subscribe. Do that now. Tap on the notification bell. Like this, you don't miss out on these updates that I put on a weekly basis. So the normal alignment of the spine in the lumbar area is an ellipse. It's an approximation of an ellipse. That's super important. That's the best position it should be when you look at it from the side to give enough spaces on the discs and not cause damage on those discs. We know what the actual angle, what the absolute rotation angle, which is the global angle between L1 and L5 is based on spinal research. It should be 40 degrees. Now, when there's a loss of lumbar lordosis, watch what's happening. It can be a straightening of the lumbar spine or a loss of that lordosis. There's now compression on the anterior front part of those discs. There should not be compression there. And it's actually causing the discs to bulge posteriorly or even laterally, posterior-lateral. You may have seen that or heard that in your MRI report. And that's the mechanism of injury for the discs at L4, L5 to cause an L4, L5 disc bulge, or an L5S1 to cause an L5S disc bulge due to a straightening of a lumbar spine. So when we see a straightening of the lumbar spine, our goal in our office is to apply structural corrective care to improve the alignment of the spine and take pressure off those discs and restore as much normal lordosis as possible, which is the natural ideal alignment of the lumbar spine. And this is the basic tenet of chiropractic biophysics or corrective care through chiropractic biophysics. And I'm a certified chiropractic biophysics doctor, so that's what I learned these techniques from. Chiropractic biophysics is a science-based, research-based technique that has, at this moment, about 277 research publications. It was originally designed and founded by the late Dr. Don Harrison. He was a PhD in applied mathematics, had a master's degree in engineering, as well as being an educator and a chiropractor. Today, chiropractic biophysics is now being led by his son, Dr. Deed Harrison, who I've done multiple trainings with him in getting certified in chiropractic biophysics. So there's lots of research behind this technique. So in our office, we want to apply structural corrective care to improve that lumbar lordosis and improve the structure of the spine. In doing so, helps to relieve pressure on the discs, reduce the inflammation, allow it to finally heal properly. One of our basic philosophies in our office is that surgery should be the last resort. The goal for patients should be to treat this as conservatively as possible when it comes to structural alignment problems of the spine. And if necessary, surgery is always an option. It should be a last resort. So that's why we apply these corrective techniques to help improve people's health and spinal alignments. So what we do is we apply these tractioning techniques in our office. I have other videos that demonstrate this. I'll link it in the actual description below. And we also send patients home with a lumbar dental. The purpose of the lumbar dental is to help restore the alignment of the spine. So if the spine is straight and the person is lying on it, you'll see how it begins to bend over. This peak is designed to help bend. So the person is lying on the floor and bending over that peak to reshape the spine into that normal lordosis, to reduce that straining of the lumbar spine and improve all those disc spaces and restore proper structure to the spine. So we give patients this exercise take home as part of their structural rehabilitation home exercise on top of our in-office structural rehabilitation care. So in a moment, I'm going to show you a couple of exercises you can do at home to help promote an improved and more natural lordosis in your spine, specific for a strengthening of the lumbar spine type of presentation. But before I show these two exercises, I want to share with you a patient story. This is about, let's call this person John, a man named John who came in with two disc bulge injuries, L405, L5S1. He had ligament damage because of a straightened lumbar spine, buckled lumbar spine, loss of lumbar lordosis, causing local back pain, and also the disc bulges were irritating the nerves, radiating pain into his leg. And although he tried different types of therapies, medications, injections, physiotherapy, exercise at home, even some traditional chiropractic adjustments, and there's nothing inherently wrong with all those, they're all great. The problem is it didn't address the structural problem, which was that straightening of the lumbar spine. So we started to apply these traction techniques in our office to help improve that lordosis through corrective CBP type traction, chiropractic biophysics type traction, and also gave him some exercises, what I'll show you in a moment, that to help promote that natural lordosis. And within the first several weeks of care, the actual pains began to subside about 30%. And we're still working with him, so we have some more work to go to. But already in that first 3 to 4 weeks of care, there's better mobility, less pain, and improved quality of daily living, being able to do more things throughout the day. So follow me now and watch these two exercises that can be done at home to actually help support that natural lordosis. So here are two exercises that can be done at home to help promote a natural or more improved lumbar lordosis and help reduce that straining of the lumbar spine. They're both done in the standing position, and for one of the exercises you'll need some kind of cloth or scarf to add some resistance. Put that aside for now, and we'll get to that in exercise number 2. So exercise number 1 for straightening the lumbar spine is anterior pelvic tilts or forward pelvic tilts. You'll be standing like this, and you're going to tilt the pelvis forward, just like this. Okay? I'll put my hands here like this so you can see the pelvis. That was 10 reps. So you can do 10 reps to start, work up to 20 reps, and eventually 30 reps once a day, and then work up to twice a day. If you feel discomfort or pain during it, you need to pull back a bit on that pelvic tilt. And if there's any leg symptoms, then you move to the opposite direction. So if you're doing the pelvic tilt forward and there's symptoms down the right leg, shift more to the left with the pelvic tilt. If you're moving pelvic tilt forward and there's symptoms on the left leg, then shift to the opposite right leg to relieve that pressure on that nerve. Great exercise. Now, exercise number 2, grab your scarf or some kind of cloth or towel or something, put it behind your back just like this. We're going to add resistance to the pelvic tilt. So same motion, but with resistance. Again, that was 10 reps, work up to 20, eventually 30. 2 great exercises you can do at home. And be sure to watch this video right here for more information about straightening the lumbar spine and what can be done with corrective care.